Hi folks, this is Jacklin from iCureCancer.com. Instead of worrying about the connection quality, I'm going to just take my camera out into the field and interview people I find interesting. So we won't be doing the Skype Google chat thing today. I'm going to go and see Dr. Rex in Beverly Hills to interview him on what it's like to be a naturopathic doctor. I think it's high time we all traded in our MDs for an ND. Because to be honest with you, you really only need an MD if you get in a car accident and you're in the emergency room. Other than that, you need somebody that knows how to take Mother Earth and make it work for you so you can heal from the inside out. Just my opinion, but I hope you enjoy the show, folks. Thank you.
My name is Rex Wilson. I'm a naturopathic doctor, and I have been in practice since 1979. And I graduated from National College of Naturopathic Medicine in Portland, Oregon, which is the longest running naturopathic school in the country. And I guess the way I got into naturopathic medicine is that when I was a teenager, my grandmother, who was a registered nurse, got my family a subscription to a health magazine at the time called Prevention. And this was back in the, I think, 1968, 67, something like that. And because my grandmother was kind of into that type of thing, and she took vitamins every day. She lived to be 94. And I started reading those issues every month, and I just got totally fascinated because it was all these stories about herbs and nutrition and natural healing and whatnot, and I just really resonated with that. Well, in terms of our training, we get basically the same number of hours and years of schooling. Our clinical studies are somewhat different. Our basic science background is very equivalent. We're trained in all the standards, chemistry, biology, biochemistry, etc. We learn all the same basic diagnostic techniques, but our philosophy is different. We, obviously being natural medicine profession, we look at the body as an interconnected whole, and it's not just a series of individual parts that you treat separately, you treat the whole person. Naturopathic medicine is really the original natural healing system in the West. Our equivalent in the East would be traditional Chinese medicine or Ayurveda, as an example. So in our clinical years, instead of just the drug pharmacopoeia and surgery, which is what medical doctors learn, we are trained in homeopathy and different systems of herbal medicine, diet and clinical nutrition, physical therapy, body work, just a lot of different natural therapies. And we get some training also in the other traditional systems like Chinese medicine and Ayurveda, which can be pursued as a separate study after graduation if you so choose. So we're sort of the holistic, natural equivalent of a medical doctor, would be the best way to put us. 4 years with 2 years clinical internship, and that is after you have your pre-med. You got to get your pre-med first. So a program basically will take 8 years.
So in essence, it's no different than becoming an MD.
In terms of the amount of time spent, no. Some insurance companies will cover our services. It just depends upon the policy. You know, there's more and more awareness of preventive medicine, of course, in the U.S., and some insurance companies are trying to cover it. So our services are sometimes covered, sometimes not. It really does depend upon the company and the policy.
Is that a thing you have to worry? Your job as a doctor is to cure people, but are you afraid of curing people because they might come after you? Have you heard of that?
Well, I'm not, as we said, I'm not going to get into that in detail, but being around as long as I have practicing, yes, I have seen what happens to doctors who get too successful treating cancer biologically with natural medicine. They do often run into trouble, and it's just something that I chose not to get into. If I was working in another country, it might have been a different story, but here in California, no, it really is, it's just not a climate in which you want to get too well known for treating cancer with natural methods, so I do not do that. People come to me with those problems. I will work with them as long as they're under the care of another primary physician for their cancer treatment. I can then offer ancillary support, or I can refer them out to other clinics in other parts of the world or in the U.S. that do more advanced natural cancer therapies, and I'm always happy to refer people. But I haven't really had the kind of facilities and setup to get into that in any great detail on my own. And there's plenty of other places people can go, so I just have elected not to get into that. Well, I would say if it was me, I would look into other alternatives just so I know what is available besides the traditional treatment methods. I refer people to the the Cancer Control Society here in LA because they are a clearinghouse of good information on alternative therapies. And I have, names of certain practitioners around the country and the world and different clinics, and I give people that information. And then it's just up to them to follow up and do the research. Really, I am a general practitioner. I work on just about anything. I do a lot of immune system support, a lot of digestive conditions, musculoskeletal problems, fatigue, of course. To some degree, I work with emotional, psychological problems, but just general, everyday health care. Most naturopathic doctors are really just general practitioners, although some do specialize in certain areas. Well, on a first visit, I spend an hour and a half with a patient. Return visits are almost always an hour because it takes that long to listen to the person's description of their problems and assess the situation and figure out what might be going on. I do some, testing in my office, and I often refer out for other types of tests. I may order lab work, but obviously when you're doing preventive medicine, you can't make snap judgments about what the patient needs. You've got to really delve into the situation and do some testing. So they get a lot of time. And then we make some determinations as to the type of treatment to go with, and it's always completely individualized, person to person. Two people could come in back to back to see me with headaches, and they might end up with a completely different program to follow in each case. Because one person's headaches might be caused by one thing, another person's headaches might be caused by something else. Well, everything on the desk here comes under the overall heading of what you might call biofeedback testing. These are things that for the most part interact with the human energy field, what we usually call the biofield these days. You can get a certain amount of useful information on how the body is functioning from those approaches. So I take the information I get from those testing methods, and I will look at that in correlation with any lab tests that we have, and then we just look at the data and figure out what is going on. So these things don't take the place of lab work, but they give additional information which you can't get just from laboratory testing. So when you combine it all together, you get a more complete picture. Plus I get a better idea of how to approach treatment by using these types of modalities as opposed to just lab work.
Is there any way you could try and begin to explain to a regular person's mind how a computer could somehow touch your skin on your body and figure out what's going on?
Basically the technologies are based upon what is called German electroacupuncture testing, which was developed back in the 50s or 60s in Germany, originally with non-computerized devices. But they measure galvanic skin resistance on different acupuncture points. And from that, you can get an idea as to how the different parts of the body are functioning. And the Germans also developed something called medication testing, which basically is a way of testing what effect a supplement would have on the body by seeing if it alters a reading on an acupuncture point, an electrical reading. Now, of course, this is not accepted by traditional medicine, but it is accepted by alternative medicine, of which I am a part, and so it works in my practice.
What do you think about strength testing for supplements?
Well, muscle testing also works, and it's a similar principle. In both cases, you're basically accessing the human energy field in order to see how the body is responding to a supplement or a product. And so the principle is similar, it's just obviously done in a different way. Muscle testing can be very accurate. I mean, it has stood up in courts of law. Chiropractors have gone to court and defended it very successfully. So it's just a question of, is the person doing it, well trained and accurate in their testing. But certainly the principle is sound from my viewpoint.
You have a lot of supplements here. Do you find that is that obviously that's instead of drugs, you use supplements?
This is what I do. This is what all naturopathic doctors do. They treat with supplements, diet, lifestyle recommendations, herbs, and homeopathy. Those are our primary modalities. And to some degree, drugs. Some naturopathic doctors can prescribe various classes of drugs depending upon their licensing. But for the most part, we rely upon natural medicines like you see here.
First do no harm.
Exactly. There are situations, obviously, where drugs are needed. If someone came in to see me and they had a bladder infection so bad that they were feverish and, you know, having blood in the urine, that's not the time to use herbs. That's the time to go to an antibiotic. But if someone came to me and they had had repeated bladder infections over the last year and they were coming back every month and they would take another round of antibiotics and it goes away and then it comes back again, well, now that tells you that you have to work on the patient themselves and you have to work on the terrain, the condition of the bladder and the urinary tract, and that's where the herbs and nutrition come in. Then you need to strengthen and detoxify the body, and then the infections hopefully won't keep recurring. But drugs have their place certainly for emergencies. No, I see, from my viewpoint, people are getting sicker. I see more and more problems all the time. Yeah, it's true. The toxicity level in the environment is really causing problems for people. So it's getting worse.
Are you seeing success though in treating them with the modalities that are
Well, yeah, you know, if you do the right kind of support with detoxification and nutrition and so on, you can make a big difference. So we have tools to help us to offset the toxicity onslaught from the environment. But if people don't take advantage of that, if you just live your everyday life and breathe the air and drink the water and eat the food the way it's getting these days, then yeah, you're much more likely to develop health problems as time goes on. It's really requiring, I think, more and more due diligence and preventive care to stay on top of it.
Do you have families that come to you from the get-go, just like we used to go to our doctors when we used to believe in them?
I have families that I've been seeing for 30 years who still come to see me. Naturopathic doctors are basically family practitioners. That's what we do. So usually I'll get one person initially as a new patient, and pretty soon I get other members of the family, and the next thing you know, I'm the family doctor. Well, you want to have an MD on hand for emergencies, but for everyday health care, yes. As a prejudiced naturopathic doctor, I do have to say that we should be your first choice. Or a good chiropractor, or a good acupuncturist. You know, give due credit to the other professions too. They're all doing good work. We'll run another test on the nutra-energetic system here with you first. So I'm going to have you put your right hand on here with a couple of fingers on the metal and grip the rest of the mouse. That's good. Okay, the scan again. Oop, I had those two electrodes touching there. This first scan is a quick one. It takes about 10 seconds. This machine was developed by a brilliant acupuncturist from Australia, a man by the name of Peter Fraser. This machine's manufactured in England. And you can let go, that's it. So that just basically took a snapshot of your entire biofield. And this is the circulation meridian, bit of a disturbance there. The last one is the spleen meridian. And when you see something like this, it doesn't necessarily mean that there's a physical problem with the organ, but it does mean that the regulation of energy through that organ is off, and therefore there could be a functional disturbance in that part of the body at the moment. Would be environmental toxins. So here under the electromagnetic section, there's a showing on radiation. So you probably have some excess radiation exposure. Then petrochemicals, we have various types of petrochemicals showing up, so that's usually from air pollution. You got some pesticides showing up, also some tin, which is usually air pollution as well. So this is just typical things that we see just from breathing the air. So if you want to quit getting exposed to these things, just hold your breath and you'll be fine. A little low on some of the major B vitamins. No major food sensitivity showing up in the key groups here. Basically, it checks for dairy, gluten, and sugar. You got a moderate problem with sugar sensitivity, but it's not too severe. Let's just do a quick check on the intestines, and we'll also check liver and gallbladder. So again, this machine is sending electromagnetic frequencies into your body through the headphones, and then they basically are able to pick up the frequency patterns given off by the different organs in the body, and the machine tells us if there's a significant deviation from a normal pattern in the tissues. And everything looks okay with the pancreas and the spleen. Here's the large and small intestine. And everything looks pretty good in the small intestine. Let's see how the large looks in a moment. Yeah, you're okay there. It's about the same as it was last time. Okay, liver, gallbladder. Mild toxicity showing up in the liver, but nothing to get too concerned about. Let's take a quick look also at your thyroid and adrenal glands. So, compared to the average person I see, you're quite healthy.
Okay,
As
good.
well you should be, considering your lifestyle and everything.
Yeah, but then if you saw how bad I was before.
Yeah, I know you've done a lot of work on yourself. We talked about this last time, but since we're on the tape, I want to say it again. We're measuring on an energetic level. We're not measuring physical tissue. The energy field often reflects what is happening physically, but you can also have something occurring energetically that is not happening physically yet. So it's possible that I am seeing tendencies in some of these areas that have not manifested on any kind of a clinical level yet. So when I'm figuring out, what's really going on, I also have to consider the patient's signs and symptoms, their history, any laboratory testing that we have available, and then we make an assessment. But if you have symptoms of prostate problems, and I see it when I'm doing energy testing, and you test good for prostate supplements, well, then I obviously think there's more likely a chance that something's going on. But if you're totally asymptomatic, and I see a bit of a prostate problem, but you have no symptoms, it may well be that I'm picking up a tendency in that direction that has not yet clinically manifested. So there you go. And we could get into testing the supplements again, but we did all that last time. We have a pretty good idea of what you need to take, so you just need to do a program for a month or so, and then we would want to recheck you and see if it's made a difference.
Now, when somebody comes in with the sniffles, they got the common cold, would these machines pick up what they're lacking and what they need?
Yeah, that's usually how I figure out what to do there. I mean, if someone comes in with the sniffles, what are you going to do? Run lab tests and try and figure out what infection they have and wait, 2 weeks for the lab test result to come back? Obviously, you have to make a judgment call in a situation like that. So yeah, I use this type of testing then to figure out whether it's a virus or a bacteria or an allergy, and then what the person would need to take, and usually it turns out to be some sort of herbal or homeopathic formula to take care of it. So that's just, everyday healthcare. I know your documentary is going to be on cancer, right?
Yeah.
All right. Well, and I've lost patients to cancer. In the past, I haven't been treating them, but I've seen patients, go through traditional therapies and not make it. I have seen, and I'm going to be honest, I have seen some patients who went totally alternative route. They didn't even do traditional therapies, and they didn't make it either. And I've seen other patients cure their cancer with natural means. So, you just never know with cancer. Some people have good results with certain therapies and not with others. It's highly individualized. If I had cancer, all I can say is, would I do traditional therapies? No, I would do alternative therapies, knowing what I know. And, when people ask me, I just, give them the information, let them make their choices. But, yeah, knowing what I know, I would certainly pursue the alternative approaches. But I certainly sympathize with, anyone having to make that decision. It's a tough one.
Do you think that there's any hope for our future, because why we are the way we are. The 1% run the world, right? They run the medicine, they run everything. Do you think is there hope for our future, that we'll get America back and be able to practice medicine properly again?
Well, all I can say is, there's room for, obviously one could be pessimistic, but the public is becoming so much more aware now of natural preventive medicine, organic food, etc., that clearly the consciousness of people is shifting in that direction. So what I do and other naturopathic doctors and other natural healers do, clearly that is the medicine of the future. Drugs and surgery as daily healthcare are not the medicine of the future. That's the medicine of the past and still the present to some degree. So yes, people are becoming more aware and they're going to demand that. And so how is that going to play out with the 1%? It's hard to say. They're going to resist it because their 1% is making a ton of money doing what they're doing. And as long as you're getting rich doing what you're doing, you don't want to upset the apple cart. But people want something better, obviously. And I like to think that I offer something better. So I guess I have to say I'm optimistic, but how long it will take to change, hard to say. But I will say that between now and when I started practicing, there's been a huge shift. Because when I started, virtually no one knew what a naturopathic doctor was in California, and now almost anyone I talk to knows what a naturopathic doctor is. And when I tell people, I say I'm a naturopathic doctor, it's like, oh, great, thank God. So yeah, things are certainly
Just
better.
in 17 years since I discovered cancer was curable, I've seen a huge difference. We didn't know it was called an alkaline diet 17 years ago,
Mm-hmm.
and neither did anybody else. But now everybody comes to me and I go, "You on an alkaline diet?" And they're like, "Yep."
Yeah.
I'm like, you know what alkaline diet is? They're like, "Yep."
Yeah. Yeah.
So
Yeah.
to me, that's evolution. I know I had a part
For
of that.
sure.
You did. So it's kind of nice that, we were in the first wave. Kind of, you're like really hardcore.
Yeah.
Grandfathered in. But
Yeah. I'm first wave.
yeah, you came in because you got out of '68. That was when I was born. That's
Yeah.
amazing.
And yet, when I moved to California, I moved here full-time in 1980, although I had lived here previously for a while. I actually even met some of the original natural health pioneers that were still alive, people that had been at it in the 1920s. I mean, I met Gaylord Hauser. I met Dr. Bronner. I was good friends with Betty Lee Morales. I mean, these are people that were doing it in the 20s and 30s and 40s. And they were still going when I moved here. So I got to hang with some of those people and learn from them. It was a real
Wow,
privilege.
Jacklin, that's another old one, isn't it?
Yeah, no, I never connected with Jack. He and I never hooked up for some reason, but all these other guys I did.
That's great. We're running. I got a minute left on tape, and you
Okay.
just nailed it too. I
Okay.
can't think of anything else, right?
Great. Well, all I can say is everybody eat right, take your supplements, exercise, meditate, do yoga, do everything right, drink pure water, have an alkaline diet, and you'll age slowly, you'll age nicely, and you'll have a good life. I'm 61 and I still feel like I did in my 30s. And my father, who I've been feeding vitamins to since the 1970s, is now 95 years old. He's still here.